afternoon, everyone. Thank you for joining. We have loads of folks joining in here. Afternoon, everyone. So welcome to this week's Coffee Talk. I just want to introduce you and share the slides for Marco Alfano, who will present today. Thank you, Marco. And Marco will present on digital health transformation for person-driven health and well-being. So I think we'll get started because we're just 1:31, and I know Marco has loads to say. So thank you all for joining, and I'll hand you over to Marco.
Thank you, Carol. Yeah, that's nice. So thank you everybody for joining, and yes, I have something to say, but I hope that it will be fruitful discussion. So it's an informal discussion. This is why it's called tea and talk. So I have my tea, I drink tea. I am Italian, but I drink tea. And I hope you have your coffee or tea or whatever you want. And it's about really digital health transformation for person-driven health and well-being. I'm Marco Alfano. I am a senior researcher at the Innovation Value Institute and also lead of the digital health cluster. And I'm also a member of the SFI Liro Center for Software. And I will talk about this topic. And again, I hope that we have a fruitful discussion. So we're just waiting for a few people coming back. I
just want to make sure I have that.
Yeah, okay, no problem. So, I just prepared a few slides just for introducing really the discussion and mainly what are the main elements that are part of this digital health transformation for person-driven health and well-being. And there are many drivers that are really moving and pushing us to go towards this approach, this new vision, because we are really moving towards more kind of holistic approach to health and well-being. So not just really look at the specific diseases, but really look at more the health and well-being of the person as a whole. And it's also important that people at this time want or need also to have an active role in managing the health and well-being. They can really understand and make informed decisions. And there is at the same time a rise in aging population and chronic disorders, so really people should engage more and understand more, because also life is getting, let's say, longer, and the quality of life is very important. How do we behave and how we act to make the quality of life the best as possible for us is very important. Of course, COVID-19 has accelerated the use of remote service. We know, not only in the health field, but in any field. And also growing demand for services, remote care and services. People who want to stay at home. There is this new also paradigm of hospital at home, trying to bring the hospital at the home of the patient as much as possible, so that to really having people to stay at home as much as possible. And at the same time, of course, there is a government healthcare cost problem, and to have an active role, people to have an active role in their health and well-being is something that is very important also in order to the government to reduce the cost of healthcare in general. Still many barriers in this new vision that are, because still healthcare is mainly related on disease management. It mainly focus on the specific diseases and solving the local problem. And a few health application services are there in the market for people active role, and are mainly working as a silos. And also we have health data that we have a lot of data nowadays. Of course, getting data is very easy, but is also they are scattered in different sites. So to have a complete view, an overview of all the data is also important, but right now it's quite difficult. Some low digital literacy in patients and caregivers, and it's important that people really don't, of course, become medical doctors by themselves, but they can really understanding on their health, about conditions of health in general. And some resistance of the physicians or healthcare professionals in general to use remote services and also patient activation. Very often we hear about doctors say to the patient, don't go to the internet because you get overwhelmed of the information with poor quality and etc. And this is true, but at the same time, you cannot really stop people from the internet. And at the same time, the main health organization from WHO to EU, Digital Europe, and etc. are Ireland, also the Ireland Long-Term Care New Plan, are really putting the people in the center of their on their plans. So they wanted to have an active role. We have a few years ago about having people to have a kind of a people-centered healthcare. And of course, people are the center, but it's the role that you really should change. So from more kind of a passive role, they are recipient, we know, but they must be an active recipient. So this is why this is the digital health transformation for person-driven. This is why the name of this vision. And two elements are really important to me in this vision. On one hand, person empowerment. And I've been working now a few years on this, and mainly made of 3 steps. People understand health information, understand their conditions if they have, make informed decision, of course, together with healthcare professionals, but really understand what's going on with their health, and of course, self-management of their health. At the same time, digital technologies can help a lot. And a consumer of AI, this is AI that is used and is thought and used directly by the end user, but by the consumer. And the big health data, we have a lot of data, as I was saying before. Internet of medical things and the cloud. So these are just to mention a few. But how can we combine these two important fields, personal empowerment, digital technologies, really to achieve this vision? And we have, in IVI, we have excuse me. We have
You can do that way there, yeah.
Yeah. Okay. We have what we call a three-way solution, where we have 3 main elements that are part of, let's say, the solution for our vision, and they are all absolutely connected, because we really see we want to achieve this holistic view about all the elements of the healthcare, all the stakeholders really working and cooperating together in order to achieve this vision. The first element is the digital person empowered model. We need a new model. We need a new model. We need a digital transformation that helps to achieve this person empowered health model. And when we talk about digital transformation, we have to talk about many elements that are part of this path. And so the main elements that we are talking not about just technology, but we are talking about leadership and governance. That is very important, understanding, okay, how do we govern this process? How do we govern this change and this really paradigm change, paradigm shift? Strategy and investment, what is the strategy that is behind this model? And of course, all the legislation, policy standards that are needed in order to have this comprehensive, let's say, framework that can have this model to work in practice. And of course, technology is very important. And last but not least, people. What are the people? And when I talk people, of course, the patients or people in general are the most important, I mean, because are the recipient of the healthcare service. But it's really, as you can see from the left, this drawing are all the stakeholders that really need to collaborate and to cooperate. So it's important to understand what is the main elements that empower patients, but how should all the other stakeholders should act in order to have this digital person empowered model realized in practice. A second element is the person-driven digital health system. We need a digital health system. We need something that helps, of course, the use of technology, but so that everybody and everything is interconnected and collaborates. So we need really to have that all the technology that we have is just talking, interoperating with each other, following the model that I was just describing above, and that everything works and helps really people to access all the elements, all the services. So as you can see, the interconnection collaboration is on top. We need a set of applications that interoperates among each other. These are just an example, the ones that you see in the green square, and that they have to interconnect. They must be seen as a unicum from the patient point of view, in order to have single access to all these applications and to all the different stakeholders. This is very important, because we cannot really have an empowered model. We cannot really help patients if we don't have this integrated view. Data, as I was saying before, very important, because we have data from different sources, different data, different formats. We have to create that we can gather, collect this data and make them to interoperate, and to have a global vision on the data, so that we can really create new services. We can create new insights on the data. And of course, the infrastructure, also complete hardware, software, the network, everything should be interconnected, everything should be really work as a whole. So you see, it starts from the person driven, but it really goes towards a more integrated and collaborative environment, where all the stakeholders collaborate in order to achieve this vision. And the third element is the intelligent self-empowering agent. So I said before, we don't want just to leave the person alone and to interact with all these technology, this information, these new elements that come with this new vision, but we want to help. And so this is why it's so important to have a kind of access, to have, I call it an agent, but I would call a facilitator. It's someone, and we can of course use new technologies, is someone that helps you, or something that helps you really to interact in the best way, that understand your needs. You can see from the scheme on the right, understand your needs, understand your profile, and use AI in the best way, gathering information from external sources to provide you with tailored output that is really is tailored to your needs, is trustworthy, is simple to understand, and is providing you with the right information, and is a continuous interacting process. So it's really helping you to access all the information and all the technologies, all the services that you need, and all the people. It's really a kind of mediator, facilitator, that is helping you in empowering also from this point of view. So as you see, this is the vision and the solution that we are building. We are working on these three elements. There are projects that are developing part of this vision. If you are interested in them, we can of course talk online in another moment. I can go into more details. And this is just to give you an overview on for the discussion of today. And the last, just something to conclude and really to open the ground for the discussion is is just some questions that I think I call food for thoughts, but it's really to start the discussion, because I really it's important that we give answer to these questions for ourselves and for making this vision, if we believe in that to really happen. So, and this a question that I make to myself, but I make to you if you want to give your opinion. So how do you see digitally enabled healthcare in 5 years? And what role the patients should have? What are the most interesting technologies that can help this vision of person-driven health and well-being to become a reality? And what is the right balance between potential of new technology, but at the same time, the personal knowledge, experience? And maybe provoking a last question, should humans have the last word in any case? So what is where we should stop the use of technology and having, in any case, the person to have the last word? So that these questions to me are very important, and we are, of course, as I showed before, trying to give a solution, but it's not this is our vision, but it is really important. It's a collective. As I was saying before, is not only everybody has to cooperate in making this vision to become a reality, but also in thinking. In IVI, we work a lot on co-creation, on design thinking. So it's very important that everybody really collaborates in making and putting their own idea, so that we can really decide together where we want to go in this field that is very important, because it's about our health and well-being. And I stop here and open the ground for the floor for discussion, for questions or comments in general. Thank you very much.
Thank you, Marco.
Also drink in time.
So is there anyone online that would like to ask a question?
Hello, everybody.
Hi,
Can you hear me? Hi.
Yeah.
Maybe I would like to have some comments for the third question, not starting from the first one, if possible. I have some type of comments that there should be something, in my opinion, the balance could be something that people could recognize which platforms are reliable, because at the moment there are many platforms available providing some information related to different diseases and healthcare, and I could not recognize which one is more reliable. And maybe that's the thing, that's the question for me, that how we could provide such balance between these new platforms that every day are going to be open to the people and patients. That's my question to, I don't know, probably to healthcare domain. And Marco, you are the representative for this domain at the moment. Thank you.
I don't have an answer to this, because it's actually is what we are trying to achieve. Is really to is to provide the patient, the person, with all the information when also to choose the technology. Is not to choose the technology in a blind way, but and sorry, we are talking a lot about the trustworthiness, trust in the, but in inform is this to me is a consequence of information, understanding. So what is the technology? Of course, I don't have, and I cannot become an expert in digital technologies in medical domain, but I have that I need to understand really how can use the best and what is really that technology is giving to me, so that I can make my decision in the best way. But this is what we are trying to do, and of course is important that we really have a real understanding of how the technology is going to help people to make best decisions. But it's not an answer, it's just another question. Ita wants to also to participate to the discussion.
Sorry,
Ita, you have to unmute.
Sorry, I did,
There we
and then I
go.
didn't. Now can you hear me? Can you hear me?
Yeah.
Okay. Yeah, sorry. So following on from Zore's comment, I also, and you know, I'm very interested in regulations and the proper implementation of regulations. And one of the big concerns I would have is that there are many products available which in effect are medical devices or being used as medical devices, but they're not ratified. And I think, you know, so in some cases, there will be systems, either software or hardware, that can be used without being ratified, but people need to know and understand it. And it always concerns me that what the person, the individual who doesn't know about software, what they're worried about is data security and privacy, but they don't see that there's a whole plethora of software, you know, calculations and decisions being made in the background, and that these decisions may not be made properly because people haven't developed them properly. So without over getting into the legislation side, I think there has to be a very big awareness around the legislation side and what the difference between a ratified product and a non-ratified product, what it actually gives or doesn't give. And I think there's a huge education to the general public around that.
Thanks, Ita. Very interesting comment. Very interesting comment. Thanks. Anybody else?
Actually, Marco, if I just come in there, if I jump to actually the last point there, should humans have the last word? In any case, I think kind of a very politician's answer probably that it depends. And I think if there was some sort of, much like Ita's talking about the kind of classification of the devices and that, but if there was like, whether it's diagnosing, there's a lot of good technologies out there now, you know, for screening for certain diseases that have been validated and approved by the FDA. But if there was maybe to kind of say whether humans have the last word or not, but if there was almost like a categorization of the types of services that are being delivered by these healthcare technologies, and the kind of a, you know, with, again, like the classification of medical devices, if it's 1, 2, or 3, you know, if it's critical, if it's, you know, what is the risk and things like that involved in decisions that could be coming from this software. I think if there was some sort of categorization or classification around that would kind of help say whether where human input is required and where that, as you put it, the last word comes in on from either humans or the AI or software that's making these decisions. One other point as well, and it's from well, it obviously links to power now around data, but it actually comes from my own personal situation with my daughter who has a medical condition and has a need to, I suppose, have access to certain data. And what's really frustrating for me is that the devices that she uses, the companies that make these devices aren't sharing the data with each other. And even if you go to kind of more wellness devices like tracking activity and things like that, there's still such a lack of data sharing between big companies, so that we can't actually maximize the information coming from that's being generated into actual decision making. Even when you go and meet your medical consultants and things like that, the information is still isolated and it's not joined up. So I think looking at where we want to kind of see things in 5 years, definitely more open in that case as well, where we can actually where patients can actually benefit from all this data that is being generated.
That's a really good point. I think, sorry, it's Anna here, and apologies, I was a little late, so I missed the maybe context setting for the discussion. So my questions may seem left field, and apologies if they are. But I agree, Manus, with what you're saying there about the data availability, and one would think as a patient, these are the metrics that belong to you, that you should have a say over where they're used and how they can be used to your benefit, etc. But I suppose my question goes back to the beginning. Marco, are we talking about a solution here that's aimed for use by a well person who may become sick, or a well person who wants to stay well and encouraging that? Or is it for somebody who has some illness or disease and managing the care provision? I might have just missed the context at the start. Sorry about that.
Actually, it's both. It's
Okay.
for both possibilities, because of course we are, what I was saying at the beginning, of course, for people who have already diseases, and maybe the empowerment thing, I work on patient empowerment, and if you are already diseased, of course, probably you already have some knowledge. But it's important in any case that you have the possibility to have a system that helps you to become, as Denise was mentioning, to become more, let's say, more information, more services at your own, let's say, depending on your needs. So even if you have a disease, but you can always get more information, more data that are connected, etc. But this is also thought for people, let's say, just for health and well-being in general, to prevent disease, to have a more holistic approach. I was talking at the beginning to have this more holistic approach to the health and well-being of a person, rather than to focus on the specific disease. But this does not prevent. I'm not saying that if you have a disease, this is useless. It's still useful, but it is exactly, it's useful in both cases. Let's say for both of the two scenarios that you have described.
Understood. And in approaching, I guess, this, because this is truly one of those most wicked of problems, being so big and complex, is the approach that you want to take in terms of developing this a kind of an agile, iterative approach where you start with some very small, simple use case and extend and build upon, or have you got that far yet, or are you beyond that?
Sorry, sorry, I didn't get your question.
The question I'm asking is, I suppose, how do you see this product being developed? What's the strategy for developing it? Do you see it as something, well, one thing I suppose, and it maybe goes to question point 3 there, is the balance between the potential of new tech and person-centered. I would always propose and be passionate about everything should be person and patient-centered. And I suppose there's a difference for me between a person and a patient, because a patient is labeling somebody as with something, whereas a person who isn't a patient may have a different profile, and that's a small point, but I think it should be person-centered. And my question really is, what's your strategy and your approach for developing this product? Do you plan to start small and enhance the product, or let's pause there.
I was presenting before, because we are developing a model and a digital system and an intelligent empowering agent. So are 3 elements that are just all interconnected and they all work together. Of course, we cannot solve everything, but all 3 elements. And when we talk about the model, there are all the elements that we were discussing. There is the strategy, the governance, there is the regulation. I was talking about standardization. There are the data, there is the technology, there are the people, all the elements. When we talk about digital transformation, we cannot, of course, just think about technology and that's it. We have to look at all the different elements. So we are working on all this. So the model, we are also trying to understand what it would be, what would the digital, this interconnected, interoperable digital health system of the future would look like. And then we would also work, and we are working on developing an intelligent, empowering agent that helps directly the person to interact and to become empowered and interact in the best way with the digital health system that is kind of surrounding this person.
So I suppose sorry, I'm for hogging the questions. This is my last one, promise. So I guess the question I'm wondering about is, right, I hear what you're saying about technical solutions and platforms and the 3 components, completely understand all that. But what benefit, what value would that provide straight off for me as would say, hopefully a healthy person versus somebody who has an illness? What would be your first use case, your first value proposition, if you like, for a user using this system?
Yeah, for example, it would be for someone who is, as we said, that is, let's say in general is healthy, but maybe has some problem from time to time. We have developing, for example, the intelligent empowering agent that is helping you in understanding possible complaints and diseases. You get a complaint, you have a complaint, instead of going immediately to the doctor, maybe you have to go, but maybe instead of just panicking or go to the doctor, you try to understand what's going on. And our system provides you with this kind of information. It's also kind of a triaging. So if you have a sharp abdominal pain, of course, maybe it's better you immediately go to the hospital and you don't look at information, but it depends what you have. You start to understand, and if you have to go to the doctor to understand more, if you talk to go deeper to understand what's going on. So it's about a person who can have possible complaints and understanding more what's going on and connecting to the healthcare system and getting all the services that is needed. If he needs to go to the hospital, he goes to the hospital. If he can have a remote, for example, teleconsultation with a doctor, that with the technology can offer, that also is a possibility. So I really want to have this integrated environment. So it would be someone was potential complaints and ask for help. And it is a first kind of, let me call a first aid agent. First aid agent in terms of providing you with information, the direction of what to do.
Yeah, understood. Thank you.
Thanks. I don't know if there are questions because I think we ran out of time.
Just out of time.
Yeah, I don't know. There was
Just
yeah, you were
information, and Marco, that's maybe something we can discuss afterwards. In particular, it was kind of from Denise's comment, but also the discussion now just around what the benefits are. Maybe we need to emphasize the more like the pull effect, like basically, so you're designing it based on demands from people at least, so around this. So because when you're talking about the agent, it's more like a kind of a platform, and we're pushing it again towards the people. So it's basically like Denise had a really nice example to actually requesting the sharing of information, because that information data is somewhere belongs to the person, to the and we should have something like even freedom of information, like you can request that, and that brings back to the regulation. So if you have data about, and we want to share that with a medical doctor, with the hospital, that you have the right, that they actually really need to share this and make that possible. So kind of very similar what that effect, the freedom of information effect had on transparency. So we should have something like that you actually can demand this, and that then you empower really people around to use the data and the value. So that's just for kind of us, that push effect, and how we present that around, that might be something to think about.
Yes, and the discussion about data, of course, Marcus, is very important that we are working in different fields with data, how to use data, and how to better understand. Just I'm aware of time. Just on that, it's just before this, we just to understand, and because we said we work with people, we are going to run some focus groups with Age Friendly Ireland, so with a group of other people that will try to understand, to work, to play. So if you want to with our system and get feedback, what they really want, what they really need. Because it's important, because this is our idea, but maybe it makes sense, maybe it doesn't make sense, and working with real people. So I really look forward. It will be in middle of October, and for a few weeks we will work with people and understand their needs. But there is also this event, Research Week, and you are all invited. There will be Wednesday and Thursday, October 26th and 27 for the Maynooth University Research Week. We will talk about exactly about these new technologies in health technology, what is the right balance, exactly those questions we will try to answer. We will provide some solutions. We are also in contact with some companies that will showcase their their solution, their technological solutions, but we want to understand with people really how to move forward. We want to hear from everybody. So if you are interested, please come. It's 2 whole days, Wednesday 26th or 27th here in Manut and IVI to see what we are doing and to discuss with us.
Maybe just on this kind of idea why it's 2 days. So we don't expect that people are there for 2
Yes.
days, but it's time whenever suits. So it's kind of more like a path, an exhibition path to show actually what digital health means, from initial data sharing to actually maybe something a little bit more kind of what consequences, positive, negative consequences. So to really spark the conversation and the discussion around what digital health has in positive effect, a negative effect maybe, and what technology can do. So the time is up to you whenever. It's a really interactive way, more like an exhibition type of thing.
Yes, and so please come. And this is, by the way, is not the only IVI activity for that research week. So back to Carol.
Yeah, and I'll keep it short and sweet, guys. Thank you so much for joining us, everyone. I'm sure we could talk for a lot longer. So if you are around on Research Week, as Marco said, please do drop in and just some more information on keeping in touch, and join us on LinkedIn, our Twitter. Drop us an email anytime on the info, and we'll pick it up. As Marco said, there's some other topics for discussion, as you can see there, for the Research Week. So again, there's the link down the bottom, or drop us an email just for details on registering. And yeah, we hope to definitely speak to everyone soon. And thank you all so much for joining. Thank you, Marco.
Thank you very much.
Thanks, everyone.
Thanks.